Circumcision is an operation that involves surgical removal of the foreskin, and the foreskin can become tight, causing problems. In some patients, the tightness can be only in the erect state, while in others it can be tight all the time. This can lead to quite a few issues. For example, problems with keeping things clean, so maintaining hygiene. It can also cause pain during intercourse. It can cause infections, and sometimes you can get redness and inflammation over the head of the penis, something called balanitis. With balanitis, the head of the penis becomes quite sore and swollen, and in severe cases, the foreskin can become stuck to the head of the penis itself. So for this, a circumcision is usually the recommendation. With a circumcision, you would come into the hospital as a day case, meaning the procedure is done on the same day and you would leave later the same day itself. The operation is done under an anaesthetic. The choice of anaesthetic depends on patient preference and also your health conditions. With a general anaesthetic, you're put to sleep for this, whereas with a spinal or a local anaesthetic, you're awake. So a spinal anaesthetic involves an injection in the back that keeps you numb from the waist down, whereas a local anaesthetic involves an injection in the base of the penis that numbs the penis. The operation itself involves a circumferential incision across the foreskin. The foreskin is removed and any bleeding is carefully controlled. We put some stitches at the end, and these are all dissolvable stitches. Over the course of about 4 to 6 weeks, these stitches would gradually disintegrate. After the operation, you would have typically a gel-based dressing as well as some gauze to keep the wound protected and dry. When you're home, we normally suggest you take some regular painkillers, perhaps for the first 1 or 2 days. Bear in mind that since the foreskin is no longer covering the head of the penis will feel and look different. It can be a little bit sensitive the first few days, but after a while, your body gets used to it. You may notice an altered sensation over the head of the penis, which can be permanent. The recovery side of things is fairly quick. Within about 10 to 14 days, most of the time, patients would start noticing an improvement. It can take up to 4 to 6 weeks to completely heal, during which we would probably advise you to avoid sexual intercourse. If you did get an erection when things are healing, occasionally it can tug or pull on some of the stitches and a small area can open up. Don't be too concerned. It will heal, it can just take a little bit longer.